Hello everyone, Kent Bressler here. I want to welcome you to Kent's Kidney Stories. During our time together over these podcasts, I'd like to discuss kidney disease. I'd like to tell you about my journey as a transplant patient, but also talk about dialysis, kidney donation, and just about anything else that might be of interest. Kent's Kidney Stories, podcast endorsed and sponsored by kidneysolutions.org.
Hello everyone, Kent Bressler, and we're going to do a podcast. We're going to do a Kidneyversary this morning, and so this is going to be sponsored by AAKP, which is the oldest and largest independent kidney patient organization in the U.S. It's dedicated to improving the lives and the long-term outcomes of kidney patients through education, advocacy, patient engagement, and the fostering of patient communities. AAKP fights for early disease detection and the appropriate diagnosis of rare or genetic conditions, increased kidney transplantation, and preemptive transplants. Full patient choice of either in-center or home dialysis, protection of the patient-physician relationship, and promotion of research with innovations including artificial, implantable, and wearable kidneys, and the elimination of barriers for patient access to available treatment options. Okay, that's my story for AAKP, and I'm sticking to it. Now, what I really want to do this morning is say a prayer before we get started, because I've got a real interesting guest with me, and I want to get started right away so we can hear from him. Let us pray. Lord, I ask for your guidance today as I set out for better opportunities than yesterday. Do not let me stray from my path, for you're my shepherd, O Lord. Let your staff prevent me from any error, and let your eyes watch over me and protect me from all danger. You're the only God, and no matter it's too big for you, nothing is too big for you, Lord. So let flatten all issues that may plague my day. We ask this in your holy name. Amen. This morning, or afternoon, or night, whichever comes first for where you are, I have a good friend who is a member of AAKP and NKF and just about anything else you can register. We're going to talk about his transplant and his Kidneyversary, and in general, I think you're going to enjoy this fella. Welcome, Robert Friedman, or Bob.
Hello, Kent. Hello, everyone out there in Kidney Land. And thank you for joining me in celebrating this amazing milestone. May you all experience what I've been through, the good, forget about the bad, and may you see the same future that I am enjoying. And I just have to begin by thanking the gentleman who chose to be anonymous, who made all of this possible. Somewhere out there, there is a man who decided to give me the gift of life. And there's not a day that goes by that I don't think of him and thank him for making this all possible.
Bob, I'm going to tell you something. I've known you for, I know at least 10 or 12 years. We've on our journey with NKF and AAKP and just on social media, and you're a good friend. And I want to tell you, I draw inspiration from you, especially because of your knowledge base in kidney disease. Tell me a little bit about your kidney transplant, and tell me about the whole journey, really, if you will, please.
Okay. Well, for many kidney patients, it really begins with the unexpected. I was diabetic for 40 years. I took incredible care of myself. And then one day, the doctor told me I had end-stage renal disease. Now, if you're going to call a disease something, give it another name, please. And next thing I knew, they were poking a hole in my arm and my chest, and I was in dialysis. And you know what? Something's missing. Number one, nobody picked up earlier that this was happening. And number two, once it happened, no one made me aware that there were choices in dialysis. And in fact, that such a thing as a kidney transplant existed. And when I think back to the welcoming group of people from very, very different backgrounds that I met in dialysis, I'm one of the few that actually found out about transplants, connected myself with world-class healthcare, and received a transplant. Some of this is white privilege. Some of this is just the fact that our healthcare system does not reach out to people in need at the point that they can decide. Because I have to tell you that for so many patients, they're not able to decide. They are kidney disease rots away at your mind. And between anemia, fatigue, and the mental toll that dialysis takes, at the point that people really realize that things are turning bad, they're not able to try to act on their own behalf. Now, in my case, I decided very early in the game, when I became aware of transplants, that I was not going to accept a transplant for my kids. Why? Because they were then in their early 20s. They were at the same risk of diabetes that I was. And I figured this just was too much to ask of them. I was really ignorant about what's involved in being a donor and in the medical consequences. And I was aware that things were getting worse. During those 6 and 7 years, you're going to get worse and worse and worse. So I had a heart attack. I had numerous instances of emergency hospitalizations. And finally, I was knocked off of the list. And I had to wait a year before I could go back on. So there I am, waiting and getting worse and worse. I have to tell you that one of the things that kept me alive was prayer, not my own prayer, but the prayer of a community that really was rooting for me. Friends, neighbors. I had a kid that we were friendly with, a neighbor, and she had 100 kids in her school praying for me every day. So the support that we had, 75 people at the kidney walk marching for us. You know, how could I not? And then my wife and family saying, you got to do something about it. Now, there was an organization in my community, Renewal, advertising, holding up their little kidney. And they're in the very Orthodox Jewish community. I have a real problem. Even though I'm Jewish myself, I really believe that charity should be non-sectarian. And I had a problem going to a more sectarian group. But I've learned a lot of interesting things about this group. It works within the more extreme Orthodox community. And because that community is so interconnected, there really is a spirit of giving that is very profound. And so that they have performed over 600 kidney transplants in cooperation with local hospitals. And a tremendous outpouring. They go into synagogues, they teach people about kidney disease, which helps them as patients, prospectively, as family members, and as prospective donors. And that result is that at the point that I was at the end of my rope, I was able to get a transplant. Now, another thing that kept going, all those meetings that you and I went to from 2000, I was diagnosed with end-stage renal disease in 2010. By 2014, Erin, who most of you from AAKP know very well, had brought me into her fold in those days in the Kidney Foundation and brought me to Washington to advocate. Now, I used to do this for a living, but one of the things that happens when you get kidney disease is you forget who the hell you are. You lose your identity.
Yes.
You become one or another decrepit kidney patient. So my wife took me to Washington, and I put on a suit and tie, something I never wore in dialysis. Now, I did in dialysis wear fancy dialysis wear that I found online, sweatshirts with zippers, but my ties, forget it. 100 ties sat in the closet for years. I put on my suit and tie. I went to Washington, and they threw me into the fire. And you know what? I suddenly discovered, hey, I could do this again. And that kind of empowerment is precious. Now, I think it's really important because everyone's talking about finding out what do we do about kidney disease. If you want to see the cure for kidney disease, or at least the way to slow disease progression, just look at our kidney community. The activists that I know of all backgrounds and all colors each have some magic ingredient that keeps them going far beyond they or anyone around them believe they could get. So there I am at the end of my rope. My name has finally come up on the UNOS waiting list. Phone rings. Oops, sorry, doesn't work out. Phone rings again. Ooh, we have a kidney for you, but it's from someone who has been quite impaired for a long, long time. And frankly, if I'm going to go through this, I want to have a prognosis that it's going to last, if not for 30 years, like some of you veterans, at least that I'm going to get a good lifespan out of it. So while I'm waiting for the right kidney to turn up, and what can I say? I'm a picky shopper. I get this call from Renewal. The gentleman has a family. He has about, I think, 6 kids. He happens to live in my neighborhood. He was anonymous, but my wife spoke to his wife in the waiting room, and she figured out who he was, and she got the dope on him. And it seems that he wanted to wait until his son had a wedding, and then he didn't want to tell his kids where he was going. So he kept it a secret, and he told them he had appendicitis and needed to get his appendix taken out, which begged the question that my wife found out his wife was asking: whatever happens if his appendix flares up again? What is he going to tell his kids?
Yeah.
So now I had already lined up my ducks. I have to say that through my years, the transplant coordinator at Weill Cornell was supportive, informative. She helped teach me a great deal about kidney medicine, and I also taught myself a lot. At one point in my life, I was accepted at medical school. I chose not to go, but I still brought some of that to looking into the subject. And finally, I had a surgeon. I first had a fascinating surgeon who, interestingly enough, was trained in the military. He was a Quaker, and he fulfilled his community service obligations. And from my experience, we all talk about the problems with the VA, but there's some great medicine that happens in the VA, and particularly around kidney care. And he was VA trained, and I was very disappointed when he left. And I ended up, in fact, not suffering too much because I got Sandy Kapoor, who was the head surgeon there, the guy that started the chained transplants in America. And Sandy was my doctor. And on March 6th, the date that the Kidney Summit was happening, and I was supposed to be advocating in Washington, I was on the operating table.
I remember that.
Yeah, exactly.
We talked about that all the time. We talked about that. But I wonder how Bob's doing. I wonder how he's doing with the transplant. We were trying to figure out how to get a hold of you. That was great.
Well, I've always been like a bunny rabbit. You give me anesthesia and the operation's over, and I jump out. Okay, where's the espresso maker? I'm ready. Let's go home. I must have been the 7-year siege suddenly caught up with me, because when the surgery was over, they couldn't wake me, shake me. They couldn't get me to move. They were really concerned. Finally, they stirred me out of the depths, and I smiled. And Ken can see I have a picture of myself in bed smiling right after the transplant. And I only had one question. analytic SOB that I am, I said, did it work? And the doctor said, yep. And I said, how do we know? I needed to know more.
Yeah.
And he said, because a whole lot of pee-pee came out.
There you
And
go.
I learned that we don't mince words in the kidney community. So, recovery, I have to say, before the age of COVID, being in a place that had astonishing nursing care, great standards of cleanliness, fabulous. I did, however, have a problem. And, this is one of the flaws when you see how medicine by the numbers sometimes fails people. Something didn't feel right. I was throwing down. I couldn't hold down food. And this went on for a couple of months. And I was very concerned, in particular, because the inability to hold down food. Well, on one hand, I lost a lot of weight and I could fit into really stylish, tight jeans. I also was concerned that I'd be unable to hold down my medications.
Right.
Which
Exactly.
for anyone on immunosuppressants was really significant. And they were not that concerned. Finally, one day, my wife was concerned that I would get dehydrated, that I was getting really depleted, and they brought me to the ER. And they looked at what I was throwing up, and there was bile. And they started doing tests, and they discovered, in fact, that I had a hernia, which I since have discovered is not that uncommon in abdominal surgery.
Not at all.
Lo and behold, I found a very good surgeon, an expert in robotic surgery, and I'm convinced he did my hernia operation while he was on the beach from his smartphone. But net result is they fixed the hernia, and it was getting back on track again. Now, the thing you discover with transplants is, there's sort of a myth that a kidney is like a spare part in an auto shop. It goes bad, you get a replacement, and you're fine. That may be really good if your memory dies in your computer, if your carburetor dies in your car. But one of the things that most people don't realize is that the kidney is almost like the brains of your metabolism. And when it starts to fail, so many other systems are affected. And it made it very, very difficult. So what I thought would be a sudden recovery and back to normal, in fact, is a balancing act to keep your metabolism intact. And it entails, it's why I take about a dozen different medications to deal with my various ailments. But more importantly, it's why, when you look up on a database, drug interaction, you see every damn medication that you have has a contraindication. It interacts with something else. And that's why there are pharmacists on the transplant team. And that's why expert people can balance. And it's important that a patient realize that you got to let them know how you're reacting, because there are choices of amount of dosage, mix of medications, alternatives depending upon your response. And together you can find out what works.
How many medications, true immunosuppressive medications, are you on?
Okay, I have, because number one, I am a type 1 diabetic.
Right.
Kidney disease, if you don't start off getting it because you have multiple risk factors, you end up after 7 years of dialysis and kidney disease with a plethora of health problems.
Sure.
So when I get that drop-down menu of health conditions, there are two things that intimidate me as a 69-year-old person filling out uniforms. One is having to scroll forever to get to the year of my birth.
Yeah,
the other is, why did they just tell you check the ones you don't have?
Exactly.
I haven't been pregnant. My last period was a long, long time ago, but otherwise I check off almost every box on the grid.
Takes forever.
Hypertension, the history of, exactly. But for each one of them, there is a
medication. Yeah.
Now, this is one of the areas where, in some ways, the world of kidney medicine is evolving, because kidney patients see numerous specialists, and each one of them will prescribe. This is a problem with prescribing in general, various things. Sometimes they don't go together in an absolute sense, but more importantly, they're not fine-tuned.
Right. And can't be
so
fine-tuned.
The need,
they really
need
can't
for
be
doctors
fine-tuned.
to collaborate.
Yeah.
They can. You know what? But in some places, for instance, let's say you were to go to the Mayo Clinic, or a place that has a comprehensive disease management program where all of the professionals are reviewing your medication regimen and working it out collectively. You stand a much better chance than if you have 6 different doctors and you're trusting that they're each in tune with what the other one is doing.
One of the things that upsets me right now in the community is the nephrologists say that they want you to have a PCP, and that every time you get ill or you go to the PCP, the first thing he does is picks the phone up and calls the nephrologist. So there's that's a mix. But back to the medicine part of it, medicines, I've been on the same 2 medicines for almost 35 years now. What immunosuppressives are you on?
Mm-hmm.
Are you on CellCept and Prograf?
CellCept and tacrolimus.
Tacrolimus,
And one of the reasons why I selected the fact is that the IPRO guides will tell you all the transplant centers in your area. You can look at the data on their outcome, but that's sort of elusive, because sometimes the places with the worst outcomes have it because they're reaching out to the neediest patients.
Exactly.
And they may in fact be the most skilled. Yeah.
Exactly.
So
point well taken.
But you want to get a sense of their philosophy too. And now it's sort of become the norm. But when I started in the search for a transplant, one of the reasons why I picked Weill Cornell was that they would trying to find taking as much as you need to do the job and as little as you can is really an important consideration for not only anti-rejection, but for your long-term health.
That's one of the things.
So the philosophy.
One of the things that you just said there is very important to me. I always tell my folks, when you get on a medication, especially immunosuppressive, it's not the dose so much as are they reducing it as you get long in your kidney? Because all of these things are nephrotoxic. They're all kidney killers.
Yeah.
Okay. Long term, and you have a lot of side effects. You're going to have side effects anyway, but the lower you get, the less chance of having a major side effect is. It's important to do that. Get it minimized.
Exactly, and you know what? Unfortunately, or maybe fortunately, we're all getting older, and our bodies are going through a lot of constant transitions. I had COVID about a year ago.
Did you really?
Threw off a lot of my metabolism. Yeah.
Okay.
It's sort of weird because I was talking. It's a little diversion. I was talking yesterday, getting ready to do some Washington advocacy, and a year ago, I was getting into a debate with some people in our community. Number one, I flagged that COVID was going to have both short-term and long-term kidney implications, because years ago, I had what's called myocarditis. It almost killed me. I was supposed to get a heart transplant from a simple virus that would have done nothing to a kid, but went to my heart.
Exactly.
So the possibility of a virus having systemic implications, most people are unaware of. And when I saw, what the COVID virus was, I immediately saw that there would be both long-term and short-term kidney implications. And also that I suspected it would affect people of color, as kidney disease does, more. So anyway, I'm probably not going to get a second COVID dose of the vaccine, because its efficacy hasn't been tested So, keeping up with the research, unfortunately, the lives of most of our doctors, be they nephrologists or PCPs, primary care physicians, are so complicated. Their time with patients is so limited that a good doctor is going to respect the research that you do and what you bring to the table, because they can't be on top of everything.
Exactly.
And your particular situation, and to the extent that you can bring it in, it's helpful. Now, I have a PCP, and why I have him is because he was my son's best friend's father in preschool. So we go back a 20 years. He knew my heart before I knew him. He's also a cardiologist. And I found out the other day that when he didn't answer his phone, that he retired. So after all of these years, I have to find a new primary care physician. And as luck would have it, but I do a lot of individual consultation with other kidney patients. We all share information. And a guy called me about a year ago that needed some information about getting a transplant. And I discovered the guy was an internist at the same hospital as my transplant center. And yet this was a new terrain for him.
Yeah.
And it suddenly dawned on me, I was thinking about a PCP, and who better to meet my primary care needs than someone that understands the lay of the land, not just as a physician, but as a kidney patient himself. And so I'm going to try it, but I think on your issue of picking up the phone, there are a lot of things where he will know when to appropriately pick up the phone and when to not pick up the phone.
Because he's lived it.
Find it. Yeah, exactly.
Because he's lived it.
Exactly.
I want to take you back. I want to take you back one step. I want to take you back to the moment you woke up after surgery. I see the picture of you in the background. Unfortunately, people aren't going to get a chance to see that. Tell me
the moment.
What happened the moment you actually woke up? How did you feel?
Okay. First of all, it's such a stark contrast because so much of what you experience as a kidney patient, you experience alone. One of the things that kidney disease does is increasingly takes you away from life and away from social relationships. And, and yes, you've got a family that's there pushing for you. But I have to say, that moment when I woke up was not a solitary moment. It was a moment that you share so profoundly with the people at your bedside. And I don't know who was more excited, myself, my kids who had been on daddy watch for countless days and nights, my wife who literally, as a diabetic, my diabetes was unstable with my kidney disease, and she picked me up off the floor and brought me to the ER numerous times. And I don't know who was more excited. And so it was a moment of pure and utter joy. And and the best thing about when you're anesthetized and you're out of it, brain fog is great. It makes you feel really good.
Yeah. The thing of it is, the people I talk with, the vast majority of them say at the point of time when they wake up, they feel better. In other words, they feel recovered. They know that this transplant's already working for them. Even if their kidney is quiet or if it starts right away, when they wake up, there is a feeling of joy de vivre and an excitement, and they feel alive again. Did you have that feeling?
Yeah, and it's sort of funny because when you realize it, there you are in bed. There you are getting out of bed, taking your baby steps in the hospital. The fact is, life is making damn few demands on you. And so it's really easy to rise to the occasion. And then you hit the real world and life becomes a little bit more of a struggle. But, I would say that for most people that I know, it takes about 6 months before you reach your new normal. And what I have to say that the first thing that's really startling, people talk oftentimes about how kidney patients are depressed. Well, I don't really agree with that because I have found like dialysis clinics to be loving, sharing, and caring places. And the people may be totally knocked out physically, but emotionally, I have found that they still care about things, care about each other. And that's not depression. Okay. Now, I myself expected that after all those years of kidney disease, that my brain was really wasted. I couldn't do the kind of things, the reading, the work, the paperwork, the other things that I was able to do. And there's too little attention that's being paid to the cognitive impairment that sets in with end-stage renal disease. But the good news is it kicks back in. It's reversible.
Exactly.
That brain fog lifted.
Yeah. I have never
And
had it
that was
so
startling.
bad. Yep. And it just, after the transplant, all the time that I've had my brother's kidney, I've not had that fog. I've had some fatigue and, irritability and all that stuff that goes, with growing up and aging. But I never had the brain fog.
You had that before, Kent.
Yeah.
You know what? And the problem is that if, we're suddenly going and we're asking people in their chairs in dialysis, do you want to get a transplant? First of all, they're so damn tired. Second of all, if you're waiting like 2 years into the game, they're starting to lag. And this entire question of involving kidney patients as partners in their care, if we don't address the issue of their mental capacity, and I don't want to say that we're incapacitated or less than full people, but on the other hand, you got to deal with this issue, because how can you promote choice and people making good decisions and partnering with their doctors if they don't have the mental ability to do that? But the good news is that through good treatments, psychiatric treatments, hormonal treatments that have been neglected because kidney disease takes a toll on our hormonal system, and the transplants, that the whole mental status issue can be resolved, that it can kick back in and kidney patients can become active in their own care and active in advocating for other people.
I think that your statement, I think the most important thing here that go back with what you just said is the options every patient should have. They don't get those options, and it needs to happen before they get to the dialysis chair. That's when it needs to happen.
Yeah.
I mean, you look back in your history, and I work with patients all day long because we're trying to do this preemptive thought. Let's get to transplant, not dialysis. Let's talk transplant before dialysis. And that's coming. It's more and more people.
Preemptive.
Exactly. And that's what Kidney Solutions, I'm going to get a shameless plug in here. That's what Kidney Solutions does.
Absolutely.
We work really hard with the nephrologist, but we also work with patients when they say, the doc says, well, I'm ready for dialysis. My point is, why aren't you ready for transplant?
Exactly. Yep. And, we're reaching the point where, first of all, in this country, we all move around so quickly. I mean, here we are across the land.
Yeah, absolutely.
But one of the negative consequences is that the neighborliness and sense of community that most other Western nations have is one of the reasons. And yes, their populations are less diverse than the United States. But all those factors combined such that our rate of people willing to be donors and living donors is a lot less than other countries.
And I think that's
hopefully.
Yeah, that's the most important thing. It's not necessarily the transplant; it's a donor. We got to find more of them. That's just the way it is. And you're absolutely right. Listen, right now, I want to try to get you to tell me in your own words how much importance it is to be transplanted, but also how it's really affected what you did in your later as you age. What are you looking forward to now as you get older? And I guess the most important thing is, are you prepared for aging?
I'll to that question. First of all, is given that like kidney disease hit me when I was just about 60, when I was sort of hitting my peak professionally and other such, I wasn't even thinking about the next stage of life. I thought I would never retire. I wasn't thinking about my kids progressing. I'm now at the stage of life where I have 3 adult children. They're all, thank goodness, in good situations. They, in some ways, are in relationships. The idea of becoming a grandparent, something that was never, the life cycle stopped when I had kidney disease.
Yeah.
And, the idea that all of those dimensions can resume again are phenomenal. I am active in kidney organizations on a lot of different levels. I'm just starting to mentor a couple of individuals through AAKP, but we've been, a person, the go-to person in my community when anyone has any questions around kidney disease. And I'm still doing a lot of that individually. I'm also, as I mentioned, I started off accepted in medical school with strong background in microbiology. And so I'm now on a lot of research oriented panels dealing with everything from planning research strategy for the kidney community to actually develop it. I'm going to finish a conference on early stage intervention to slow the progression and prevent kidney disease. And I think I brought in not only a patient's perspective, but a lot of my professional background in this. And it's exciting work, and it's work that I think is really impactful. And then the whole other things. I'm writing a children's book. I'm writing a children's book about the guy that designed Central Park, Prospect Park, and also I've always been interested in the history of medicine, and I never thought I'd become a subject in the history of medicine. But that Olmsted, the man that designed a lot of the parks all over America, also during the Civil War, organized volunteers who were the only people who used sanitary practice and didn't kill every patient they touched.
Right.
And, when people look at transplants, they don't realize that for many years, they did transplants and everybody on the table died because they knew nothing about immunosuppression and they didn't have immunosuppressive drugs. So when we look at the history of medicine, it's fascinating. It's also fascinating to me because, we talk about opposition to universal health care. And, we've seen during the pandemic, it's really hard finding out information about what's happening when you have so many different systems, public, private. And when you look back to the history of medicine, at one point in every community, there was a dispensary, and it was paid for by the local businesses, and it served rich and poor alike. So we actually have a tradition of medicine that's very different than what people think it was in the past. And it served people well. So, hopefully we're seeing changes in the way that we have to configure the world to provide healthcare. If COVID has had a bad side for kidney medicine, and it certainly has affected so many kidney patients to an untoward extent, and people of color, it's also had a good point in that the separate disciplines of medicine have had to come together to treat people.
Yes.
And the way in which we approach how to organize medicine to keep people healthy and intervene in crises is beginning to become open to questioning. It's tough. There are a lot of different interests, but hopefully the dialogue will happen. And in terms of transplants, what I would say is it has opened up my life. It has restored relationships that were one-way streets before. I was dependent. I appreciate all that everybody did for me. It's nice being able to give back and have that reciprocity in relationships. And if this damn pandemic will ever lift, It'd be nice to take a walk in a park without worrying about running into somebody not wearing a mask, breathing on me. And it'd be really nice to go to museums and do all those things. Everybody's bucket list has overflowed so much in the past year. And in the past, I couldn't fulfill any of it. Now I can take it all. And I've got the energy to consider doing as much as I possibly can. And that's great.
You know,
And I thank all of you because, as you know, Kent, we're all a part of where we each get in all of this.
I think this is a great place to wind her down. It's been a good time talking with you, Bob. And I look forward to the day when we can go back to Washington and sit in that big room and have dinner. Also look forward to seeing your wife again and seeing you in person, face to face, and being able to shake your hand and maybe give you a hug. So thank you so much for coming on.
And Kent, okay, I will just leave you one last thing.
Okay.
Kent is the only person here who could see me and could see a new reality. In my dating days, prehistoric, I would go into senior centers, and I worked in senior centers, and all the elderly women would say, he's got such nice teeth. Anyone have a granddaughter? And no one ever tells you. All of a sudden, I look at the pictures and see that after years of dialysis, the calcium imbalances from kidney disease knocked out my teeth. And of course, we know it's one of the big gaps. No medical coverage for dental needs. Kidney patients have profound dental needs. It took me a year in this pandemic, but I finally got some dentures, something that I thought only my grandfather would have. But, you know, we say, I'm looking for something that has some teeth in it. I'm finally that something, and I could have a lot to smile about.
That's right. Okay, Bob. I'm going to talk to my listeners. I want to stick around. I'm going to just finish this up, and then I want to just talk to you off mic. How's that sound? Just hang on for just a second. Thanks for coming on.
Thank you, listeners, and good luck to you all.
Thanks so much for listening, folks. Sometimes when you get our age, I'm going to tell you I'm 71 and Bob is 69. It's just a joy to be able to listen to somebody with so much energy and so much willingness to share. And that's Bob Friedman. If you listen to this on Kent's Kidney podcast, I want you to give him a good like, because he's a delight and he's so much knowledge. And I encourage every patient out there, if you are having to think about kidney donation or getting a donor, or don't know anything about kidney disease, or you want to know more, go to kidneysolutions.org. We're there for you. Somebody will be able to answer your questions, or at least get you to a point where you can get them answered. And always remember that this is your business, not anybody else's. This is your business. You have to be your own best advocate. And I can tell you right now, the best thing that you can do is seek somebody with knowledge and somebody that you trust, and then stick with them. And so until the next time, keep breathing.